we haven't talked about thyroid. A lot of my listeners are suffering from hypothyroidism, men and women. And it's, we're the food supply is part of it. All of these things, these factors are part of it. But then the hormonal changes just make it worse. Can we talk about thyroid health?
Absolutely. Well, it's very important to know that all the systems of the body, which includes the endocrine or the hormonal systems, they're all like interconnected, intertwined, and it's bidirectional, multidirectional. Everything affects this and it affects it back. In terms of the thyroid, it is bidirectional. So during the reproductive years, there are functional thyroid receptors on the ovaries. That's why most women know, every fertility doctor knows, it's what all the gynecologists would check right away. If you have irregular cycles, check thyroid.
Mm.
Because if someone has, say, Hashimoto's, unfortunately, that's like at epidemic levels, and then they don't make thyroid hormone properly, or they have nutrient insufficiencies, that they can't, like iodine is a big one, but there's others, selenium, iron, zinc, and others, that they have these nutrient insufficiencies, they don't make thyroid properly, then you're not going to have proper ovarian function. So it's really important to know that there are receptors on ovaries for thyroid hormone. Proper thyroid hormone levels are essential for proper ovarian function. Well, in menopause, you don't have the ovarian function in terms of producing estradiol and progesterone, but as I mentioned, it's bidirectional. On the thyroid gland are estrogen receptors. So if you don't have enough estradiol, then your thyroid gland isn't going to work
Mm.
properly. And that's like universal for
Yeah.
every woman going into menopause. She's going to have some challenges to her thyroid gland in terms of production of thyroid properly. In addition, the thyroid receptors, so every hormone works, at least in major part, is like more, everything's more complex than we first thought, but a major part of how a hormone works is it goes into a receptor, like a key in a lock, although, it has some flaws in that analogy, but close enough. And you turn the lock, and then things happen, like magical things happen with metabolism and so on in the cell. Well, what happens if the receptor isn't kind of receiving properly? Then even if you have the thyroid hormone, it doesn't get in properly, it doesn't create the proper response.
Right.
So all women in menopause who have insufficient amounts of estradiol are going to have suboptimal functioning of their thyroid receptors. So it's like a double whammy. And then you could say it's a triple whammy because the gut is affected in a whole variety of ways, the motility, the secretion of digestive enzymes, and other things that are involved in gut function and digestion. So digestion becomes somewhat impaired, and you may not have proper absorption of the vital micronutrients that I mentioned in order to make thyroid, the T4, but also the conversion. So T4 is what the thyroid gland predominantly makes, and that's like storage. It's a storage form, like you have a savings account. Well, it's nice if you have a savings account, but if you live in a cash society, you have to have cash in hand. The cash in hand that you use to spend is essentially the T3. So T3 is the active form of the thyroid hormone, and it gets converted in various organs like the intestines, the liver, the kidneys. It gets converted into T3 from T4. Well, in order for that to happen, you have to have these critical micronutrients. And if you have poor digestion, of course, if you have a poor diet, that just adds insult to injury. But even if you eat the right diet, well, the food supply is not what it once was in terms of micronutrients because of depleted soils.
Right.
That's a big problem. And if you don't digest properly and you don't absorb the nutrients properly, then you'll have a nutrient deficient state in your body, and you won't be able to actually make the thyroid hormone properly in the first place, but you also won't be able to make that conversion from T4 to T3. And most doctors, like conventional doctors, don't even check T3.
Yeah.
So you won't even know. And once again, we don't really have like a clinical tests that we can use to test, because this is more from research, to test the function of the thyroid receptors. We already know this will happen, but even if your levels look normal, or they're so-called in the reference range,
Mm-hmm.
it doesn't mean, and they could be at the very lower end of the reference range. A reference range, by the way, is not a normal range in terms of, you need to know how to interpret your lab test. So
Right.
a reference range is, a lot of doctors say it's the normal range. It's not normal. It's just a reference range. So it means 95% of random 3,000 people they tested who say they're okay, but who knows what they really are. They tested them, and the bottom number, 2.5% of people tested below that number. The top number, 2.5% scored above that number. So 95% of all the people tested scored from the bottom to the top number. But if you're just barely above the bottom number, what are you, in the bottom 3-4%? Like that's, would you want to have the bottom 3-4% IQ?
Right.
Income, whatever. So, you got to really understand that it could be in the reference range. It doesn't mean it's in the optimal range, and it may not be good for you to be in that number. So you got to then look at, well, why are you not making more thyroid? And then you got to think of all these things. I'm not saying you shouldn't have thyroid supplementation, but that's not getting to the root cause either. Like, why are you having problems with your thyroid? Maybe you don't have enough estrogen, or you don't have vital nutrients. Maybe you have gut problems, or maybe you have fatty liver. So we know fatty liver, non-alcoholic fatty liver, is highly prevalent in the menopausal
Mm-hmm.
years, and it really impacts weight tremendously,
Mm-hmm.
tremendously, because the liver is a massive factory. It produces fats, triglycerides, cholesterol, and glucose. When it's fatty and it has abnormal fat deposits in it, it doesn't function well, and it can have more production than you want of all those things being spewed out into your bloodstream. And we certainly don't want that. By the way, the new name for non-alcoholic fatty liver is metabolic steatosis.
Right.
We got to get the names right, but most people don't know what I'm talking about if I just say metabolic steatosis. So, the new name comes, but the old name never goes. So
Right.
now we have to say multiple things. But yeah, fatty liver, or whatever you want to call it, metabolic steatosis, is prevalent, and another huge impairment in terms of having problems with weight in the menopausal years as well. So we need to look at all these things.